So Dan,
yes.
Why don't we a minute? It's 2:59 by our record. There are a lot of people attending this, and so what we're asking people to do is to put their name in the chat box, because it would probably take us a half an hour to get through the list. Otherwise, well, maybe not that long. But there are a lot of people that are interested, so we're just asking people to put their name in the chat box. And then when you feel ready, it looks like it's 3 o'clock, you can kick us off.
Okay, and then somebody else is going to control the slides, though, correct?
Yes.
Okay, I'll probably go at 3:01.
Okay.
Okay, welcome everyone to our webinar from the Community of Health. I'm going to be talking today about the Behavioral Health Internship and Training Fund. Dan Ferguson, and I am the chair of the Workforce Committee and on the board of the Greater Columbia Accountable Community of Health. And we're going to go ahead and get started. And my understanding is people are signing in providing their name in the chat function of the webinar, so appreciate you doing that. Okay, let's go ahead and go on to the first slide where we'll talk about the purpose and why we're doing this. So our first slide basically is a problem statement where acknowledge that the Greater Columbia region lacks behavioral health professionals and clinical providers who are able to mentor, supervise, provide internships for trained professionals seeking degrees, certifications, and or training in behavioral health. The shortage is especially acute in rural areas, as rural organizations frequently have limited capacity and resources to provide clinical supervision, precepting, for training and instruction. Let's go ahead and go to the next slide. So the Workforce Committee and the Greater Columbia Community of Health really spent some significant time thinking about what we could do to confront, innovate, and develop a strategy that would utilize and access some of our workforce development funds to really address shortage of behavioral health practitioners, particularly as we're looking at integration of primary care and behavioral health. We've been working on this for quite some time, and Carol is going to lead us through in more detail the background of this and provide some of the details about why we're doing this, and we're looking forward to feedback and questions. So Carol, do you want to go ahead and get started with that?
Absolutely. And so first of all, I wanted to thank Dan Ferguson is the chair of our Workforce Committee for Greater Columbia Accountable Community of Health, has an extensive background in workforce development. He's currently the executive director of the Allied Center for Workforce Studies at Yakima College. So thank you, Dan, for off on this webinar today. We've had a lot of interest in this training policy because, as Dan stated in the problem statement, we have a lot of providers, especially in our rural areas, that don't have the capacity or the resources to supervise, mentor, or train people in the behavioral health field. So we're excited that we have finally arrived at a policy that launches a workforce fund for this particular area. We know that from the work that Greater Columbia has done in this space that there are significant shortages and a maldistribution of behavioral health providers in our region, and especially in our rural areas. And so we need more than just the ability to recruit people. We need an intentional recruitment and retention strategy to encourage those providers who want to practice in rural and other underserved areas. We also know that the whole effort of the Medicaid Transformation Project is towards integration of primary care or physical health and behavioral health. And when you have a shortage in behavioral health professionals, this is an impediment to an integrated healthcare delivery system. And it's an impediment to delivering whole person care when you can't get team-based care that has those types of professionals on your team. And finally, we know that access to care, care coordination, recognition, and treatment of behavioral health conditions, team-based care, and social stigma around behavioral health issues are gaps in our target workforce state. So Greater Columbia has spent a couple of years trying to analyze where those needs are and came up with a very thoughtful policy that we think addresses them in the best manner possible. Informing that policy, on the next slide, you can see most of these are members of our actual workforce committee. Wayne Pollard, Bevan Briggs, Tom Adams, Heidi Snyder, Chuck Eaton, John Christensen, Aisha Schulig, Les Stelnecker, Ronnie Batchelor, Madeline Carlson, Sandra Suarez, Debbie Spink, Rhonda Huff. They're all members of our workforce committee. And then we've also had some excellent advice from outside our Greater Columbia ACH region, specifically Ann Hirsch, Dr. Louise Kaplan, Dr. Ann Mason, Sue Skellman. Again, Dan Ferguson has been a great help. And then we were also informed through the current state assessment and our letters of interest. We've been looking very closely and following the Sentinel workforce surveys of 2018 and 2019. And by the way, those surveys were really heavily populated with Greater Columbia ACH responses. So thank you to our providers who responded to those surveys. And then we did our first regional assessment in 2017 that was conducted by Eastern Washington University. We also had the advantage of looking at the Washington Behavioral Health Workforce Assessment that was produced in 2017. And then our navigators who have been out in the field talking to all of our provider organizations have weighed into this policy. Just last week, Dan and I were able to present this policy and talk to the workforce board about the behavioral health training policy and got some really good feedback from that board as well. So the purpose, on the next slide, is the reason that we're doing this is that we're trying to support organizations that are willing to precept, supervise, or train professionals seeking careers in behavioral health or having a behavioral health component who need clinical experience in order to complete their education and certification requirements. And so this policy really helps provide some guidelines for those organizations that are needing some financial support to provide those internships. And these funds can be used to support the expansion of a care team that include behavioral health specialists, which might include a community health worker or peer counselors, or it could be in the higher level degrees, degree programs, even master's and PhD levels. And it's really meant to complement existing certification and training guidelines. And if you have any questions, just raise your hand in the chat box and we can address those as we go along. So what do we mean by behavioral health? This was actually quite a discussion at the workforce and the board level, and we came up and adopted the SAMHSA definition that behavioral health means the promotion of mental health, resilience, and well-being, the treatment of mental and substance use disorders, and the support of those who experience and are in recovery from these conditions, along with their families and communities, the promotion of mental health, resilience, and well-being. So that's what we mean by behavioral health. So what do we mean by applicant? So the definition for applicant is an organization submitting a request for funding from Greater Columbia ACH. Such organization may be primary care, behavioral health, substance use disorder, or any organization involved in the delivery of behavioral health. So you'll see that this policy is really directed toward our provider organizations as the applicants applying for funding. What do we mean by intern? So an intern is a student or graduate undergoing supervised practical training, a student or trainee who works, sometimes without pay, professionally to gain real-life work experience, or a graduate of an education program obtaining supervised postgraduate experience required for independent practice. What do we mean by preceptor? So in some avenues, preceptor is the same as clinical supervisor, so we have that added as a definition for preceptor. The preceptor is an experienced professional who provides the intern a structured learning experience, training, and observation that identify best practices and problem-solving situations. So it's the preceptor who structures the learning process to achieve a set of formally identified learning outcomes. For example, a licensed nurse who is employed by the facility in which the clinical experience takes place and who agrees to provide supervision to a student for a specified period of time during the preceptor's scheduled work hours in order to assist the student to meet identified learning objectives. Do we have any questions yet? Not yet. Okay. So we are going to dive right into what are the requirements then for these applicants to our provider organizations. And when we took a look at the funding that it was available, we did say that preference for the funding will be awarded to applicants participating in GCACH practice transformation programs, although other applicants may apply for the funding. We have approximately 67 sites that we are currently working with. We've heard from a great number of these sites that there is a special need for this kind of use for the fund. And so since we already have a relationship with those providers, we are giving preference for them, but that doesn't mean that other applicants can't apply for the funding. In fact, when we look at the scoring criteria, there will be certain things that set these applicants apart. The second requirement is that the applicant and its preceptors must demonstrate the capacity, competency, and willingness to provide behavioral health training and clinical experience. We understand that there's actually training to become a preceptor, so it's not a skill that's easily obtained. There's some actual skill and learning that has to go into becoming a preceptor, and that the applicant will work with the intern to develop mutually beneficial objectives that meet the need of both parties. The applicant will provide an evaluation that demonstrates the efficacy of the program. This is a brand new program. It's never been launched before from Greater Columbia. I think it's actually fairly new for the state as well, and so we'll have a lot of opportunity to provide feedback to the state legislature and the workforce board about the success of this program. And so that is going to demand a little bit of evaluation by the applicant in order for us to improve or do any process improvement. Excuse me. As such, the applicants then will provide a written plan documenting how and what activities the intern will participate in. For example, what kind of practical experience through projects and or patient care, special assignments or research that supports federal, state, and community-based programs, policies, and best practices in the prevention and treatment of behavioral health issues. Again, preference will be given to applicants offering rural practical experience or rural practice experience, interprofessional training and learning, and or team-based care. And this is actually something that came out of the workforce study, is that it's really valuable for interns to be able to get that kind of professional experience and interprofessional training as an intern. We're also requiring that the applicants allow the intern to participate in at least one Greater Columbia ACH Learning Collaborative throughout their internship, which, if appropriate, will count toward their required training. And that's because as an ACH, we really want to understand and learn how well we can improve the program and how well it's going for the intern. And we offer these learning collaboratives throughout the year, at least monthly, so that the intern will have a lot of flexibility in choosing which meeting they'd like to participate in. Any other questions? So what are the requirements for interns? The intern must be a U.S. citizen, a permanent resident, or a deferred action for childhood arrival student, a DACA student. Individuals on temporary visas are not eligible, and additionally, individuals must be authorized or eligible to work in the United States by law. The intern must be enrolled in a degree-seeking program at an accredited higher education institution or seeking training or certification required for employment and/or licensure in a behavioral health field. Interns must have a minimum GPA of 3.0 on a 4.0 scale, or have graduated from behavioral health professions program for those obtaining supervised postgraduate experience, or enrolled in, or have completed their education for an improved education program whose curriculum is accepted by the Washington State Department of Health for appropriate credentialing. And then we have a couple of more requirements for interns. The internship would not apply to students receiving online coursework from a non-accredited school without classroom training or instruction. And again, the intern is expected to participate in one GCACH Learning Collaborative during their internship. Any questions? No questions so far. Okay.
It's not broken.
So a little bit of a description about the applicant process, and there's quite a bit of description about the application process. So the applicants may apply for a one-year award, and that kind of depends on the program that the provider or organization is associated with in terms of their academic institution. Some academic institutions are on a 4-quarter or a 3-semester cycle, with the possibility of renewing that internship for an additional year. Funding awards are available in amounts of $5,000 up to $40,000 per year per award. And again, this is dependent on the application and what that intern will be doing and what the expenses are of the preceptor. Stipends can be used to support the travel and lodging for the intern. So it's not just for precepting or backfilling those funds from that are lost for the preceptor to precept and not being in clinical practice. Those stipends can actually be used to support the intern. And the applicants may apply for up to 3 internships or preceptorships or trainings per year, or for a total not to exceed $120,000. And this question came up because there could be preceptors that want to train more than one person in their practice, which is basically the next bullet, that the preceptor may supervise up to 2 interns at the same time, as long as it meets the requirements of the educational institution to which this clinical training program applies, or the licensing requirements for which supervised postgraduate experience is met. Applicants must have an existing application process for interns or develop an application process in order to qualify for the behavioral health internship and training funds. Such application process must be approved by Greater Columbia ACH prior to the award of funds. So we just want to validate that there is a robust application process in which to select those interns. Part of that application process then is that applicants will demonstrate their desire, willingness, or need for those interns, students, or learners. They will demonstrate the efficacy of their internship, assign a preceptor for the duration of the award period, and provide a post-evaluation of the program. Funding will be paid to the applicant in increments or in total, depending on the amount of the award. So, for example, if you're receiving $5,000 to $10,000, Greater Columbia ACH will pay that in full upfront, and awards exceeding $10,000 will be paid 50% upfront and 50% at the end of the internship, preceptorship, or training period. And again, since we've never done this, I think Greater Columbia is going to be fairly open and flexible and try to work with the provider organizations receiving the funds. Should the intern be unable to complete the internship program, or should the applicant discontinue the program, Greater Columbia reserves the right to recover monies that have been dispersed to the applicant on a pro rata basis, and that the intern will apply for the internship through the applicant. Again, this is fairly new. What we have learned, though, is from our provider organizations, is since they get the majority of requests for the internship, it made sense to us that the applicant would be that provider organization, because you receive primarily your contacts from the interns. So the interns contact the providers, and the providers or the applicant will apply for the funds to Greater Columbia ACH. We're going to take you a little bit through the application itself. I think we actually have a copy of the application in the PowerPoint presentation that's kind of at the end. But there are basically about 3 or 4 sections that we wanted to explain to you about the application itself. So in the application, we ask for you to explain a little bit about your relationship with Greater Columbia and current or past commitments that you've had with Greater Columbia ACH. I would like for you to list your sources of funding to precept interns if you have a fund. There are some organizations that have a formal scholarship set aside for internships. There are others that don't have any other sources of funding, so we're providing a budget template that you can fill out in that application, and then whether or not you currently offer internships in your organization, and that if you have an existing application process, we ask you to attach your internship application, and if you don't have an application process, then please specify what criteria you would use to select the intern. We have a question. Oh, yes, and we have a question. Does this mean that only accredited online schools with actual classroom instruction will be accepted? And the answer is yes. This was quite a discussion that we received from one of the instructors at CBC that felt like the accredited schools that were online with classroom experience were really preferable, and that online classroom experience is not the same as having actual in-person instruction. Does that answer your question, Juan?
He's on mute.
Yeah. Okay, but he could say yes or no.
Mm-hmm. Okay.
All right. Thank you. So now applicant intent, I think, is the next slide. So now we're kind of asking our organizations, why are you applying for preceptor funds? That might be fairly straightforward. That gets to your intent of why you're asking for the funds, and that we're asking how your funds will be used to support your internship program. And then what opportunities, if any, there will be for bidirectional integration, interprofessional education, or cross-training as part of that internship. We're really looking at having these opportunities available for these interns that are looking at cross-professional education experiences. Number 4 is please describe the internship program you're proposing and your organization's capacity to implement the program. And what criteria will be used to select the preceptor. And then please explain the anticipated role and the responsibilities of the intern and the preceptor. Please list the location or locations of the internship site or sites, if you have more than one that you're proposing, and the time frame or duration for the internship. Another question that came up that was posed by our board of directors is, what target population do you aim to help address through this internship? The next slide is about the intern. If possible, if you know the interns that you are thinking about precepting, would love to know the name and the proposed intern and their specialties. A note that we're limiting this to 3 interns. And then please explain your internship evaluation process. For example, you might be using a process from an educational institution. If so, that they're providing you with that template or that format. If you are doing your own evaluation, please describe how it is going to be used within your organization. Note this is a requirement and must be provided to Greater Columbia ACH within 14 days of the completion of the internship. And then please list the intern's accredited or certified educational or training institution. Then a little bit about the preceptor. I mean, like really little. There's only, I think, 1 question, which is, if possible, please provide the name of the preceptor for each intern and their specialty. The next slide is the budget template that will be included in the application, and we've got some ideas on things that you could list. Your income for your program and your expenses for your planned budget. So you might include things like the stipend for the intern or the funding amount to backfill the preceptorship, things like that. So today is the first day of our open application process. You'll be able to find that application on our website along with the policy. We're keeping the application process open from January 13th through Friday, February 28th. So that gives you 6 weeks to apply for the internship fund. We will have scoring by the workforce committee by March 12th. It's pretty tight turnaround, so we'll probably be looking at these applications as they come in. And then hopefully a decision will be made by the board of directors on March 19th. Once those funds are released or those decisions are made, we'll be releasing those funds in April. And then posting for the frequently asked questions, they will be posted weekly on our Greater Columbia ACH website. And there is one thing that our selected applicants will have to be registered in the Washington Financial Executor Portal, and we will help you through that process. It's fairly straightforward. Our Contracts and Finance Director, Becky Cullen, can certainly help you through that process.
Yes,
right, Becky?
Yes, I can.
So where to find the application? You'll find the application for the Behavioral Health Internship and Training Fund at www.gcach.org. And then our applications are accepted through Friday, February 28th. So I can address any of the questions that might be in the chat box. The other thing that we can do is unmute everybody, but we ask you if we're going to unmute you, that you don't have any other noise that's going on in the background so people can be heard. So we're going to try unmuting everybody and see what goes. So we have unmuted everybody. We're not getting any caller feedback. So if you have a question, I would entertain your questions.
Hi, yes, I have a question.
Sure.
So we currently have, so I'm a school-based, I work for a school-based health center, and we currently have interns as a part of our process. However, we work on a school schedule. So we usually host an intern through June and then start up again in September. So we're kind of on a different schedule. Are we still eligible to apply, and how would you recommend that we identify that?
Sure. Yeah, you are definitely recommended to apply. and we will just work with you on your schedule for your intern. So we expect that might be breaks in the schedule, maybe January through June, and then again September through December. So just let us know what your schedule is, and we'll be happy to accommodate that.
Okay, great, thank you.
Carol, this is Dan Ferguson. I just want to say thank you for going through the PowerPoint and providing all that information. I think as the Workforce Committee was looking at developing this in partnership with the board and the various organizations that we went to for their support, we really wanted to encourage organizations to respond to this and to innovate and to really access this these funds, this support, so that we become kind of co-creators of solving what this real workforce challenge is. Trying to kind of maximize that collective benefit, that shared interest, in really developing our workforce across our region. So thank you again for going through this and providing all this detail.
Thanks, Dan. And I think that we're looking at this as really a partnership with our provider organizations, knowing that you know, we lack these certain professions in our community health centers and our provider organizations in our rural areas across the state. So this is a grand experiment that we want to be really flexible with, as we have been flexible with our sponsorship policies. There's another question from Teresa. Am I correct in understanding that these funds can be used for supervisors and interns? Yes, that is correct. So we know that it takes time away from your preceptors or your supervisors to supervise interns. And so this funding is allows for you to kind of backfill some of those costs for precepting or supervising interns. You're welcome.
And this is Bridget with Community Health of Central Washington, and we actually at this point already have a robust pre-doctoral internship program where folks are finishing their final year before becoming psychologists, and our entire internship is set up for getting behavioral health providers, namely psychologists in this case, to get to a point where they're used to working in integrated care as well as, you know, rural settings and whatnot. And so is there any issues with us applying, even if we kind of have because we have to pay for this out of somewhere, you know, is there anything that would preclude us if we have kind of a formal process already?
Nope. You can, Bridget, it's nice to hear it from you. No, this is definitely a benefit, you know, that we'd like to extend to our community health centers. So thank you for providing that service in the past, and the hope is that you will be able to provide more preceptorships if in fact you can get some training funds to do so.
Yeah, okay, cool. Thank you.
Welcome.
This is Diana from Garden Village in Yakima, and we have had preceptors here from some of the nursing colleges, but not from any other source. So I'm to understand from this conversation today that will be not only nursing, but from other areas of higher learning as well, correct?
Yes, that's correct.
Awesome. Okay.
I should say that the state workforce board has taken quite an interest in this internship training fund. Dan and I got to meet with some of the folks last Friday, and last year during the legislative session, there was talk about establishing an internship and training fund. We were disappointed that the state legislature didn't act on it, so we just went ahead as an ACH and moved forward with this policy, knowing that there is a huge need in our Greater Columbia ACH region. So we're excited to be the test pilot for the state. It would be great if we could get state funding to match what we're doing, and so we're sort of exploring that. Dan, I didn't know if you wanted to add anything else about that, but we're really excited about this policy. We think it's gotten some great vetting and input from some healthcare workforce professionals. So I don't know if you wanted to say anything more about the workforce board and where they're at with their training policies.
Well, thanks, Carol, for bringing that up. Yeah, it was an exciting meeting on Friday with the legislator, who is very interested in providing some very targeted workforce development funds to support behavioral health development. And I think what we clearly heard was, because this is a short session, there's some they're not sure about what is actually going to be able to be provided. I think but the primary area of focus is, I mean, for lack of a better word, turning up the spigot and addressing any kind of barriers that prevent clinicians from getting into the workforce. And I use the term clinician broadly, so whether you're looking at getting licensure for LCSW or mental health professional, or even peer support and community health worker, nursing, it's across the board. So we don't want to. We certainly, as a workforce committee, we're not wanting to get too prescriptive in terms of what it is that organizations and communities are thinking that this is really what they're hoping to develop. The state Workforce Council is currently going through a second round of assessment regarding issues around licensure and reciprocity, and identifying barriers that may in behavioral health workforce development. We're happy to send out the link for those meetings. There has been some initial reporting, and there's going to be a final report to the legislature in December of 2020 of this year. Yeah, so there's going to be a lot of focus this year as well as next year on behavioral health workforce.
There's a question from Becky Groves. Are there any sources that are training CHWs that need internship opportunities?
Training?
I know that peer counselors are in big need right now, and so I think, Becky, what you're asking, are you on the line, Becky?
Yeah.
You want to pose this question?
Yeah, basically what I'm asking is, I don't employ behavioral health specialists, but I do use a lot of community health workers around SUD and behavioral health support services out in the community. And so I'm just wondering, how would we fit into this? Obviously, we've been doing it a while and more than happy to train community health workers, but would that be something to get more community health workers out in the community doing that kind of support work? And if so, yeah, where would individuals that, I mean, technically it's not an internship, they don't require an internship, but is that kind of what you're thinking, to kind of get them into the workforce?
Right, because they need experience being able to function in a team-based environment, Becky, and so the whole idea of getting community health workers some experience in that team-based setting is very valuable.
Yeah, the community health worker training really provides baseline knowledge, but it doesn't necessarily train them into meeting specific needs if they're tied to the behavioral health service area. So have a process which in itself is sort of an apprenticeship that goes through some guided training probably would help with that.
And I think one of the barriers to hiring CHWs is they don't have that clinical experience, Becky. So I would think that that would be a valuable resource to have is trained community health workers with clinical experience.
Okay. Thanks.
Okay. Is there any other questions from the audience? Well, we might be able to give you back some time. Again, you can always reach out to Lauren Noble, who is kind of on task of tracking the applications with your questions, and we will be posting those frequently asked questions on a weekly basis. But if are there any other questions, I'll pose it one more time in case something has just come to mind. And any of us are available to talk to you about the internship policy offline. And we look forward to seeing your applications. Send them in. Thank you, everybody.
Thank you.
Bye-bye.
Bye.